But there was a study that asked patients who just had surgery, would you have liked to have had more information about what you could have done before surgery to just impact your outcomes, impact your recovery? And the answer was overwhelmingly yes. So patients want to know. And then the second study, there was a meta-analysis, and they looked at all of the surgery prehab studies. And what they found was that prehab studies that used many approaches, so sleep plus nutrition plus exercise, had the biggest bang for your buck. But those that just looked at one intervention, just nutrition, just exercise, also had overwhelmingly positive outcomes. So once again, like you said, if you just do one thing, if you just work on your sleep before surgery, don't do anything else, it's still going to be a big stride in your recovery that you wouldn't have had if you didn't just do that one simple thing.
Mm-hmm. Yeah. So if you're listening and you're like a type A personality, then it's okay. You don't have to do it all to be successful. All right, Becky, thanks so much for joining me today. Today, we're really going to get into how do we achieve better outcomes for surgery? What can we do before going into surgery? How people do before going into surgery to really get, through it better, to have fewer side effects afterwards as well. So thanks for joining me. I'm just going to give you a little quick background for everyone listening. So Dr. Rebecca Knackstedt, she's an MD, PhD, board-certified plastic surgeon and reconstructive surgeon, a member of the American Board of Plastic Surgery and certified in functional medicine at the Institute for Functional Medicine, which is pretty darn cool to have a MD as well as functional medicine certified. And then co-founded the Clara Recovery company with her husband, and who is also a fellow physician. And I think this is pretty neat. I want to get into this at some point, maybe not today, but you have experience designing and carrying out clinical studies, have published over 80 peer-reviewed articles, and have won numerous local and national research awards, which I think is pretty fantastic. So why don't we start by telling me a little bit and our audience a little bit about what got you into supporting women with preparing for surgery?
Yeah, thanks so much for having me, Megan. When I was a resident at the Cleveland Clinic and I was rounding on patients after surgery, I would always see what they were eating. And they're eating things like donuts and Coke, and they just had this major surgery. And that was the first kind of evidence to me that patients really didn't know what to do after surgery. As a resident, I wasn't spending as much time getting to know the patients before surgery. But then when I progressed in my residency and started to spend time in clinic, I found that patients often did ask the surgeons, what can I do to prepare? What should I be doing in the next couple weeks? And the answer was always, I don't know, eat healthy. No one knows what that means. So the patient really just walked away from that encounter thinking, I still don't know what to do. So when I started my own practice, I took my background in functional medicine and my PhD was focused on vitamin D. And I was convinced that as long as you had good nutrition, you were going to do great after surgery. That's all you needed was some food and some supplements. But then since I specialize in breast cancer reconstruction, I got to know my patients and I found that the nutrition was really just a piece of the puzzle. These women were dealing with stress and anxiety and relationship challenges and sleep deprivation, all stemming really from this super stressful diagnosis. And when I really embraced my functional medicine background and started looking at these patients more holistically, I found that by taking this more whole body, whole mind approach, I really was able to help patients achieve better outcomes, smoother recovery, and just getting back to feeling like themselves faster.
Awesome. So it's more than just taking this or that supplement, eating this or that food. There's a holistic view that you're taking here, basically from mental health, physical health, all those kind of things.
Absolutely. And I think breast cancer probably more than many other surgeries and other cancers, because it is a cancer that is so tied with confidence and femininity and how women feel about themselves, which just brings a whole nother round of stress and anxiety apart from having a new cancer diagnosis.
Yeah, absolutely. It's very personal. It's very visible a lot of the time as well. So yeah, there's a lot of personal parts to it. What kind of side effects did you kind of see happening when people were to go through surgery? Like, what are some things that you're like, this can be changed? Let's get on that.
Yeah. So the main things that we think about from a surgeon is I'm thinking about wound healing. So are incisions healing well and fast? Are they having wounds that need surgery or wound care? We don't want that to happen. We want to prevent infections and fluid collections. And then from a functional standpoint, we want patients to just bounce back fast. So we don't want them to be recovering from a surgery in 3 months if they could recover in a month. Get them back to work, get them back to doing the activities that they love, because that's what's going to make them feel whole again, getting back into their daily lives and routines.
Mm-hmm. Awesome. Awesome. So what would you say would be kind of like your core foundational approaches whenever it comes to someone coming in with breast cancer or colorectal cancer, whichever one you want to choose with? Before they come in for surgery, what are you guys talking about?
Yes. So I actually give all of my patients a 20-page document that is all the things that they could do, should they choose to, before surgery. And I think that it's important that patients should walk away from, whether it's an encounter with me or their surgeon talking about this, feeling empowered and not stressed out. So the real message is that even if I give you a 20-page document of things you could do, studies show that if you just do one thing, you still are going to improve your outcomes. So when I think about prehabilitation or preparing for surgery, it's really a multifaceted approach. So there's nutrition and then targeted supplementation. There's stress and anxiety management, sleep optimization and how that ties in with stress and anxiety. And then from a social standpoint, who's taking care of you after surgery? Who are you talking to about these things? Because especially for breast cancer, that social network has shown to impact outcomes, even mortality outcomes. So I think really addressing all of those things independently, but also as they're all connected to each other, is the best approach to prehabilitation.
Mm-hmm. Prehabilitation. What is that?
Prehabilitation. So everyone's heard of rehabilitation. When you hurt your shoulder and have surgery, you go to physical therapy after the event. That's rehabilitation. So prehabilitation is just doing something pre an event. So it could be prehabilitation before surgery or before chemo. Within the surgical space, most studies that use prehabilitation really focus on nutrition with supplementation and then sometimes physical therapy or exercise. But once again, a true prehabilitation model would also bring in those soft, fluffy things like stress and anxiety and sleep that are so critical, but almost always overlooked.
Mm-hmm. Oh, that. So going back to like your 20-page document, we often have like clients on both sides of the spectrum where they're like, oh, yes, I'm going to do all of this. And like they will like nail it out piece by piece. And then we've got people who might get more information. They're like, I'll get around to that. Sometimes I might get one or two things done. But in the end, they end up with results because if they're just getting one or two things or if they're getting all of them done, there's some things that are going to give you like a bigger return on your time or your energy, or just kind of feeling like you're taking action sometimes preventatively can make people feel so much better. Are you finding that too? Like one or two, you get people on either side of the spectrum there?
I do. And it's interesting because there's two really good studies to support exactly what you said. So I think as surgeons, we often feel like we're overwhelming patients. When I meet a patient and she's having a breast cancer reconstruction, it's in 4 weeks. I'm giving her this litany of choices of reconstruction and it's overwhelming. So I think sometimes surgeons stop giving that additional information because they feel like they're going to overwhelm the patient. But there was a study that asked patients who just had surgery, would you have liked to have had more information about what you could have done before surgery to just impact your outcomes, impact your recovery? And the answer was overwhelmingly yes. So patients want to know. And then the second study, there was a meta-analysis. It was lovely. It was published in January of this year, coming from Canada. And they looked at all of the surgery prehab studies. And what they found was that prehab studies that used many approaches, so sleep plus nutrition plus exercise, had the biggest bang for your buck. But those that just looked at one intervention, just nutrition, just exercise, also had overwhelmingly positive outcomes. So once again, like you said, if you just do one thing, if you just work on your sleep before surgery, don't do anything else, it's still going to be a big stride in your recovery that you wouldn't have had if you didn't just do that one simple thing.
Mm-hmm. Yeah. So if you're listening and you're like a type A personality, then it's okay. You don't have to do it all to be successful. We just need these little things. And there's actual research showing that that's true. You only need a couple of things to do. So that's
Exactly.
fantastic. Yeah. Awesome. Why don't we kind of break down then what does nutrition look like for prehabilitation?
Yeah. So when I think about nutrition, I think about what a person is eating and then what targeted supplementation should be. And I think that people, especially when you're looking at social media, get very confused about what supplementation means.
Mhm.
So this is very different than if you go to your PCP and you get your labs drawn and he tells you that your vitamin D is low. So that supplement goal is to bring you to a normal level where you're just having good health and wellness. When we're thinking about supplementing pre and post surgery, your body is going through an insane metabolic demand. Your needs for nutrition are so much higher than they were just a week before surgery. So you're not getting to normal levels, you're getting to really high levels. And studies have shown that even if you have normal levels of vitamin C, zinc, things like that before surgery, supplementation can still be beneficial. So the main, once again, biggest bang for your buck is high protein diet. The amount of protein that you need to prepare your body and heal from surgery is crazy high. Most people are not getting it. And it's really for two reasons. One is your muscle is your reserve for healing after surgery. It's where you get your amino acids from. So if you start out with decreased lean muscle mass because you're not having a high protein diet, you're dipping well into your reserve. And then the second thing is when you have post surgery and your doctor tells you don't exercise for 6 weeks, you're having the second huge dip. So the first thing is protein and ensuring that you're meeting your protein goals. And then from a supplement standpoint, my favorite supplements that are most evidence-based are things like protein supplementation, but probiotics, love probiotics, have shown in multiple meta-analyses to decrease surgical site infection, keep people out of the hospital faster. I really like some of the micronutrients like vitamin C and zinc and magnesium, arginine, glutamine, HMB. The list goes on and on. Fish oil, love fish oil. I think we're going to talk about that later. But there's a lot of supplements that have shown in the literature, in human studies, or at least in really good animal studies, that it helps some aspect of surgical recovery, but importantly, has been shown to not increase bleeding risk or need for transfusion, interfere with anesthesia, or pose some other risk in that perioperative, right around surgery time. Because if we're giving you a supplement that's going to help you heal, but it's going to interfere with your anesthesia medication, that completely is not worth it. So it's being very strategic about what supplements to take.
Hmm. Awesome. So kind of like you're saying that nutrition's definitely serving a purpose, the number one thing being protein, but whenever you're preparing for something like surgery, whether it's like mastectomy or other types of surgery, which were pretty intense, your body's going to require an extra kind of level of support or cushion, I guess, to work with in order to heal faster, get better outcomes. And that's where the supplementation comes into place between optimizing your gut health, because a lot of medications get kind of processed through there, as well as your immune system. And then also like your protein demands, you're saying you're going to kind of draw from protein if you don't have enough in your body in order to heal your wounds. Is that kind of what you're talking about, eh?
Absolutely.
Yeah.
Exactly.
Awesome. Awesome. Whenever it comes to supplementation and you're talking about like these micronutrients and vitamin D, like are there certain blood work that you would recommend to get done, or does it even matter, or what are your thoughts there?
Yeah. So the blood work really depends on what type of surgery you're having and what your comorbidities are. So as a plastic surgeon that does breast reconstruction, most of my patients are considered traditionally healthy. So if they're a out of control diabetic, they're probably not getting breast reconstruction because it wouldn't be safe. So most of my patients are coming in, they might have just done chemo, but they're coming in pretty healthy. But the lab work that I like to see from my patient is at least a CBC and a BMP. I like to get a CMP actually, so I can look at their albumin, which is a good marker of their protein stores. I like to look for women who have just finished chemo, especially their ANC, which is their absolute neutrophil count, because that's going to show how well they're going to be able to fight off infection. Other things that can be helpful are some bleeding studies if you're having, if you're on blood thinners or might need to be on blood thinners after surgery. Vitamin D, I think, is always a great one. And if there's any risk of diabetes or prediabetes, your A1C.
Awesome. Yeah. Because like it's going to give you a picture of where do we need to focus our attention when it comes to specific foods, specific supplementation. If you do have lower immune counts or whatever, like we got to make sure they're not red flag too, that you can't actually have surgery. But on top of that, you're thinking above and beyond just, yes, it's safe. No, it's safe. Let's think of how can we optimize this overall by getting that blood work done. That's amazing.
Yes.
Awesome. Awesome. What about other aspects of going into surgery? So like, what about stress, for example?
Yes. Everyone is stressed. Before you even get your cancer diagnosis, everybody is stressed. So the women that I meet for breast reconstruction, they've just been given a cancer diagnosis. They've been told that they're going to have to take time off work and life and maybe not interact with their kids the way they want to. It puts strain on relationships. They're going to have activity restrictions. And then they meet me and I give them a litany of choices for breast reconstruction, which just further overwhelms them and they're super stressed out and they need to make a decision in 4 weeks. So yes, everybody is a stress ball. So I think that when you're thinking about stress management, it's a couple of things. One is, who are you talking to? So one, I love when my patients bring a spouse, a partner, a neighbor, a friend to their visit with them, because they're also going to forget about 80% of what I talk. And that's been shown in the literature too. So it's an extra set of ears. It's a supporting hand, just someone to be with them through the difficult time. So who are you talking to? I love recommending therapy and counseling, especially when I can get it covered by insurance. I think that pretty much anyone with a cancer diagnosis, anyone in general, can benefit from therapy, counseling, talking to someone who's not a family friend, loved one. A lot of breast cancer patients get put on medications for their stress and anxiety because it is so increased in that period. And I think there's a lot of shame with that, and women feel guilty, like they can't handle it enough themselves. But this is a super physiologic amount of stress that these women are experiencing. So I think that giving yourself some grace and just accepting that you might need that is very, very important. And then thinking about mind-body strategies. So journaling has shown to be very successful with breast cancer patients specifically. Aromatherapy has shown to decrease anxiety. It's one of the things I tell my patients to bring to the hospital. And then some type of meditation, gratefulness, spiritual practice has also been shown to be very, very helpful in just decreasing stress and anxiety. And then in the short term, just breathing, doing a simple box breathing or a 4x4 breathing can really decrease that acute anxiety right before or after surgery.
Awesome. Yeah, it's we're used to having communities, actually, in evolutionary wise, perhaps. We have communities where we used to all work together, raise families together, have support, that kind of thing. But now I find we're getting more and more women who are like, I should be able to handle this on my own. I am the organizer of everything.
Hmm.
I need to make sure that this works. And you know what? You can still do that to a certain extent, but wouldn't it be nice to have someone who comes in with you to take notes, even to help you prepare questions ahead of time? And basically take over post surgery as well if you need to get groceries done or kids taken care of or even help with washing your hair or something like that, just
Yes.
depending on your movement too. So that's
Yes.
fantastic advice. Yeah.
I think one of the best things that women could do, and I talk about this all the time on my Instagram page, is thinking about the mundane things you do in a day-to-day activity. So did you take the trash out today? Did you do laundry? Did you empty the dishwasher? Because you can't do any of those things after surgery. So if you think ahead of time of all of the silly little things that you do in your day, getting the kids from school, little things, checking the mail, and then thinking about who can help me after surgery, whether it's a spouse or a family member or a neighbor. And then I think the other thing is that I see this all the time in my breast cancer patients. Their loved ones want to help, but they don't know how. So what ends up happening is they bring them 8,000 casseroles. So I think that it's a good idea to, when someone says like, what can I do? Like, give them an idea. You have this list of all the activities you need help with, even if it's taking the kids for the morning so that you can have some relaxation time after surgery. But if you think about that, you enlist the people that love you and want to take care of you, it's going to make that post-operative period more anxiety free because you don't have to worry about that. Someone else is taking care of you for one.
hmm I kind of get people to remind them, like, you know how you like taking care of other people and it makes you feel good? That probably makes someone else feel good too to take
Yes,
care of you. So just remember that you're kind of giving someone happiness by helping them or allowing them to take care of you. So that's really important for
absolutely.
sure. Yeah. I like that. And journaling is something we recommend quite often. And it seems so like woo woo or sometimes simple or kind of stupid to some people, but at the same time, it's got actual research and evidence behind it in terms of improving people's outcomes for like how they feel, their anxiety, organization as well. So and it doesn't have to be structured, but if you just Google ways to how to journal, I'm sure it can give you
Mhm.
some structure if you want it. So we love journaling as well. So I love that you mentioned that.
Absolutely. And I think that surgeons we love evidence and we love like hard, fast things. We don't get into the soft, fluffy things like stress and anxiety. But when I talk to surgeons, especially for advice about that they should give to their patients, I always talk about the risk benefit. Is there a benefit to doing journaling? Probably. Is there a risk? No. Is there a risk to doing some lavender aromatherapy? No. Is the benefit there? Maybe. So when you think about the risk benefit things for a lot of these, especially the anxiety and stress interventions, they're super low risk. And even if it's a placebo benefit, it's still a benefit.
Yeah, absolutely. And then like we only have so much research sometimes in the natural, holistic,
Hmm.
functional medicine side of things, and we just have to kind of take what we've got. And like at the same time, like you take what you got, but you also look at the risk. Like the risk is pretty low, even if we don't have super strong evidence, hundreds of papers, whatever it might be, to say like this absolutely works, which we do in some cases. But you're talking about supplementation as well. Like, yeah, we might only have cell cultures or animal studies that are pretty strong. We might not have humans, but we pretty much can guess that the risk is going to be zero, and the
Right.
benefit is going to be there. So I love that. Awesome. I should have mentioned this before, but let's talk a little bit about fish oil. Whenever we're talking about supplements, I'm like, I should have brought it up. But fish oil, because like it's something that we often get pushback from when it comes to people going in for surgery. So tell me about fish oil because of the bleeding potential impacts. Like,
Yes.
what are your thoughts there?
Yes. So I would say in general, and it's for my patients too, when they go to have their anesthesia appointment, their anesthesiologist will say, stop all supplements 2 weeks before surgery, typically. And that's what most surgeons will tell their patients as well. The reason why that's said is that we don't know the interactions of a lot of supplements and how they could impact bleeding. So it's just safer to say, just stop all of them. It's not worth it. But fish oil, it has been vilified for years and still is one of those supplements that increases bleeding. And the reason is that there's cell data that it increases bleeding time. So, okay, that is true. But when you look at the human studies, all of the human studies, there's been meta analyses on these, show that fish oil supplementation, even to 8 grams a day, does not increase the risk of bleeding and does not increase the risk of needing a transfusion after surgery. And there's some emerging literature suggesting that it might actually decrease bleeding. So when I recommend it to my patients, I recommend 2 grams a day, which is well below that 8 gram cutoff. It's below that 4 gram cutoff where you start to worry about AFib and things like that. So I feel very safe with my patients taking 2 grams a day. But fish oil is wonderful. It's anti-inflammatory. It produces resolvins and protectins, which are going to decrease that surgical inflammation as you want it to go down after surgery. So I think that it's a wonderful supplement to take before and after surgery, but most surgeons think that I'm crazy when I say it.
Yeah, I know. And I hear the whole thing like, let's stop everything a week before surgery because, yeah, we don't want to interfere with certain medications. But if we just kind of look a little bit further into what medications are you on, what anesthesia might you be undergoing, like what does a long term care look like, there's definitely a lot of safety in a lot of supplements that you can be taking. So when would you suggest people kind of start like a fish oil?
Always.
Yeah.
I mean, as soon as you can. Yeah, and I think to that point, what's really frustrating is that if you don't take your supplements for 2 weeks before surgery or even like a week after surgery, you're missing that 2 to 3 week healing window where your body needs it most. All of the studies in head and neck have shown that even 5 days of supplementation, but right before surgery, can drastically improve outcomes, even mortality outcomes. So, when should you start it? I usually recommend to my patients if they're starting a new supplement with the goal of helping with their surgical experience to take it about 2 to 4 weeks before surgery and 2 to 4 weeks after surgery, depending on what the surgery is. But until they're healed, whatever that means for their individual surgery. The only supplement that's a little bit different is bromelain, which is an enzyme from pineapples, which can help with bruising. Studies have shown you really only need that for about 5 days post surgery. So that's the only one that's just for a shorter time period.
Gotcha. We usually get people to take the bromelain like away from food. Is that something you're seeing might make it
Yeah.
benefit too? Okay.
The challenge is that the bromelain is most concentrated in the pineapple cores and leaves. So unless you're making a smoothie, then you're really not getting that high dose bromelain. But and I'm a huge fan of food over supplements. But the reason why I like a supplement of bromelain is that then you know you're getting 500 milligrams, which is what the randomized control trials show is really necessary to make a noticeable improvement post-operatively. So while I would love for patients to have a pineapple smoothie, I just don't know how much bromelain is in there, so I don't know if they're getting enough.
Yeah, agreed, totally. Like we usually want to, if we're doing something therapeutically for short term, especially or whatever, for a certain outcome, we want to do the supplement because it's more guaranteed, it's more known.
Yes.
Whereas like, yeah, if we were doing pineapple the week or two leading up and then after, it's just not quite the same as actually
Mhm.
getting it in the supplement form. And I heard, and I know there's like very little research, I haven't looked it up in a long time, but like something like bromelain, if you take it around food, it ends up just digesting your food as opposed to we want it to get kind of through your gut into the bloodstream and target
Hmm,
any potential scar tissue. That's kind of why we tell people to take the supplement away from food, but I need to look that up
interesting.
probably again. Yeah, awesome. So we've heard about bromelain for potentially like reducing the risk of developing scar tissue. And just one more quick thing on that actually is I've had someone ask recently, I have scar tissue, is there anything we can recommend? And they were already like a couple months or several years post treatment. I can't remember. In that case, I don't find that the bromelain really works for scar tissue. Do you? It's usually just around surgery time.
No, because what the studies have really shown that bromelain decreases is bruising and edema or swelling after surgery. So if you have prolonged swelling, then you can develop more robust scar tissue. But once that scar tissue is formed, there's no supplement that I'm aware of that can break down scar tissue.
Agree. Yeah. It's more manual therapies that we typically refer people out to at that point,
Yes.
whether it's like massage. Sometimes we've looked into like prolotherapy as well, like injection
Mhm.
therapies to break up scar tissue. But we just have to try to find someone locally for people whenever that is the case. And we talked about fish oil and basically it's for inflammation. So whenever you're going through something like surgery, it's going to cause inflammation. It's just par for the course. And in fact, like it's part of our body's healing processes to have a little bit of inflammation, but we only want a certain amount. So fish oil can help with the inflammation and speeding up healing. We talked about nutrition and protein. Is there anything like else foundational that you feel and stress? Anything else foundational that you feel like you want to add in?
I think that sleep is often overlooked, and it's hard because sleep is so critical for healing. Even one bad night of sleep messes with your glucose regulation and your insulin and your cortisol, which all definitively impacts wound healing. But the challenge is that so many aspects of surgery negatively impact sleep. Your pain and the general anesthesia, narcotics, if you're in the hospital and you're getting woken up every 2 hours for your blood pressure check, if you're in the hospital like I am now and we have these LED lights that are destroying my melatonin production. So there's so many things that negatively impact sleep. So I tell patients that sleep's going to be a challenge after surgery, but you need to get it. So before surgery, you should really work on your sleep hygiene and figure out what works for you, whether it's shutting off your screen time a couple hours before surgery, before nighttime, using blue light blocking glasses, getting into some type of relaxation time before bed, whether it's with a bath or meditation or, a cup of tea. Because if you have those tools before surgery, you'll have them ready after surgery. But if you're in pain and you're tired and you're stressed out after surgery, it's too late to figure out what works for you.
hmm Awesome. So we can add that to people's checklists for preparing for surgery. So see if you can arrange that you have time to yourself, create a bath, a peaceful environment, improve your sleeping situation. Even ask the surgeon, I guess, ahead of time, like, will I have any sleeping problems due to whatever kind of surgery you're getting? Is that something you guys talk about too?
Absolutely. So for breast reconstruction, I tell my patients they have to sleep on their back for 4 to 6 weeks after surgery, which is almost always, apart from drains, the hardest part for women. Because if you're a side sleeper and you have to sleep on your back for 4 weeks, that's hard. So yes, definitely discuss with your surgeon ahead of time because it will determine if you need something like a wedge pillow or maybe you need to get a recliner that you can sleep in. So once again, having those tools ready before surgery.
Awesome. And then let's kind of paint a picture here. So you were to have the perfect patient come in to see you. What would that visit kind of look like? How would they be prepared to come see you?
That's hilarious. So I love when my patients prepare for surgery or for their clinic visit. So the challenge is that how do you prepare? So I think that when you're preparing for your visit, it's a couple of things. So one, I think that you should research your surgeon. So figure out what it is that they do. Look at their credentials, especially if it's an elective surgery. Are they board certified? Is this something that their practice circles around? So it's their routine. Look at the hospital system, how far it is from your home, just logistical type things. So research your team. And then research what you're having and the type of procedure you're having to have some type of baseline understanding. So when I have patients come in and they've never heard anything about breast reconstruction before, we have a lot to talk about and it's just overwhelming. So for my patients, I send them a PowerPoint ahead of time that kind of gives a broad overview of breast reconstruction, but it just gives them the terminology and just sets a framework for what we're going to talk about. But if you are listening to this and you have an upcoming appointment, I have handouts on my Instagram page of all the questions you should ask your breast surgeon and your reconstructive surgeon. So then you go in and you're not overwhelmed and your mind goes blank because that happens almost every clinic visit. But if you go in, someone is with you taking notes so that you're focusing on what the surgeon's saying and you're just having a real good conversation. And then you come with your questions, you're going to get the most out of your clinic visit. So that's the first thing. And then I think the other thing I love is I just love when patients ask me, what can I do? And then we can really have a good conversation about all the things that we just talked about. I
Awesome.
would also say strategic social media usage. So, especially with breast cancer, we've talked about communities, and I have found that, especially for my women that might not have a community, maybe they don't have a family or friend network that they feel comfortable talking about with this sensitive topic, social media can be a really great place to find people to connect to who've had a similar diagnosis or been through a similar thing, just to vent, talk. That's what social media is great for. What social media is not great for is saying that your breast is red and swollen and pus is pouring out of it at 2 a.m. Should I go to the emergency room? That's not what it's for. But I see that all the time on social media forums. So getting your social network together, figuring out who's going to support you. And if you don't have that, bringing that up to your surgical team, because sometimes there are social workers in place that can help you identify local resources or even online resources to get you that in-person or virtual support that you need.
Awesome. That's great. Yeah. There's so many resources in hospital settings sometimes that we're not aware of. And yeah, social workers,
Absolutely.
cancer clinic coordinators, and people like
Mhm.
that are really good at finding those places for you. Yeah. I like the strategic social media use.
We love social media, but just
Mm,
sometimes not all of its offerings.
yeah, for sure. And I think these things keep popping in my head randomly, but turmeric, curcumin, like, what are your thoughts around that one? Because it's a common one that I come across too
Yeah,
for inflammation.
that's a really good one. So, when I was designing the supplement that I will eventually be selling with my Clara Recovery, I initially was going to have curcumin in it. And the reason for that is that they're similar to fish oil, is data in cells that it can decrease the body's ability to clot and potentially increase bleeding risk. There has never been a single human study showing that curcumin increases bleeding risk. I don't know if this is true or not. I would love someone to weigh in, but I asked ChatGPT if I was going to have 500 milligrams of curcumin, which is what I would recommend to a patient, how much curry food would I need to consume to get it? Because we don't tell people don't eat curry foods before surgery, but we'll tell them not to have curcumin. And it was 5 to 7 servings, which is not a lot. Similar to fish oil, we don't tell people don't eat salmon, but a 4-ounce piece of salmon is getting you up to those grams of fish oils. So the challenge is, though, is that with curcumin, we just don't have as much data as with fish oil. So with fish oil, we have the safety data, and I can hang my hat on that. With curcumin, there's an absence of scary data, but there's not enough good data. So I think that curcumin for me is one of the ones that I say just start the day after surgery. I don't think that there's a whole lot of data to support you need to start it before. Don't risk it. Don't get a bleeding collection after or during surgery. Just start it the day after, and then you're still going to have all those lovely anti-inflammatory effects of the curcumin.
Awesome. Yeah, well, typically kind of look at maybe doing like curcumin teas or golden milk lattes
Mhm.
and things like that. And
Yeah.
that's safe, like a cup or two a day, because you're not reaching any potential levels that might have not been researched yet. And then, yeah, I like taking the curcumin afterwards. And one thing that we're often concerned about is the interaction with other medications, because it seems like curcumin interacts with everything. But we had to take that
Yeah.
information with a grain of salt. Is that kind of your approach as well? Or
Absolutely. And when you think about, especially my breast cancer patients, often when I meet them, they're still doing neoadjuvant chemo. So while I want to give them supplements to help with their surgical recovery, I certainly don't want to give them any supplement that could negatively impact their cancer outcomes. So the supplements that I recommend, I've actually had one of our medical oncologists look at who I trust, and he kind of verified that he agreed with it. But curcumin is one of the ones where there is kind of questionable data on how it could interact with some of the, especially breast cancer chemotherapeutic drugs.
Yeah, it's one I wish that we could recommend like to everyone all the time because it has really good cell study research and like so many different mechanisms in terms of cancer support, especially and
Hmm.
inflammation. But it's one of those ones that it's like, there's just so many things that it interacts with that we're a little bit more cautious with it.
Hmm.
Yeah. Awesome.
Absolutely.
Yeah. Tell me a little bit more about Clara Recovery.
Yeah. So I've always wanted to do this company and I finally just did it with my husband. But when I started my practice at Duke 3 years ago, I made this list of supplements and it was all of the supplements that I would recommend my patients to take for 2 to 4 weeks before and after surgery. And I did all of this research to find the third party validated company that was the cheapest option. And even with that, it was very expensive. And the reason for it is that if you only need 2 to 4 weeks before and after surgery, that's like a month. When you buy these supplements in bulk to get a cheap price, you're buying a 6 month supply. You don't need a 6 month supply of bromelain, you need 5 days. And then the other thing was, it was really challenging, interestingly, to find supplements that gave the dose of the supplement in one pill or one serving that was shown in the research. So when you look for like a vitamin C, it would be either too high or too low, and then they're taking 1.5 tablets, and it's very confusing to patients. And it was just too expensive, too overwhelming. And what I found is that similar to our type A person before, people would either come in with my hand out with like 18 questions about like, is this company okay? Is this company okay? Is this dose okay? Or patients would be like, forget it. Like this is too much. So what I wanted was an easy way for patients to do this that's affordable. So I designed a supplement that had supplements that I chose that are, like we talked about, shown in the literature to either be in human studies or very good animal studies to help some aspect of surgical recovery. And once again, safety data showing that there's no concern, thus identified, for interfering with bleeding or anesthesia or medications in the pre and post operative period. So it's called Clara Recovery. It will be fully launched within the next 6 weeks or so. And it's going to be in little gravity boxes. So you'll just pick out your little sachet, and in your sachet will be the 5 pills that you need to take that covers all of your bases for before and after surgery. And my hope by doing that is that it just makes it accessible, because the last thing that a patient needs when they're already stressed out and finishing chemotherapy is 30 pill bottles on their table with all the B vitamins and A and C, and it's too much. So this is just easy. It's one thing you have to buy, and it just covers your bases for your micronutrients before and after surgery.
Love that. So it's basically all in one place. It is research backed. It's just very simplified so that you don't have to like be super overwhelmed by all the different things that you should or could be doing. I love simple is always better, right? So that's great.
It is.
Awesome. Um, let's see. So let me just kind of recap what we chatted about and interrupt if there's anything off. So your ideal patient comes in with questions answered. They've already kind of pre-researched what kind of surgeries are available to them. Then they sit down with you in a consult, basically, and then you run through any questions they might have, run through what their options are. And then you also set them up with your 20-page document of here's some nutrition things to get started with. Here's potentially your supplements coming up soon, available soon to get started with. And then you meet with them, whether it's 2 weeks later, a couple months later, whatever it might be, you've kind of laid out a time, and then they go through the surgery, and then you also have their post-surgery kind of set up too, because you probably discussed ahead of time. Is that correct so far?
Yeah, it's correct. And I think that what's unique about breast cancer, especially, is sometimes I meet women who need to have surgery in 4 weeks.
Yeah.
And sometimes they're finishing chemo and it'll be in 2 months. And sometimes if they're having a flap, my next flap is a year from now. So your time frame of how much time you have to repair before surgery is so vastly different. But I think just remembering that even if you have one day before surgery, there are still things you can do to at least prepare your home, prepare your mind. If you have 6 months, work on your leg strength. But, if you have one day, 1 week, 6 months, or a year, there are very meaningful things you can do to prepare for surgery.
hmm And they're all very similar things, like working on stress, sleep, nutrition with your protein, especially specific supplementation. no matter like if you have a day or a week or whatever. But there's something that you can be doing that can really drastically improve your outcomes, no matter how much time, pretty much no matter what surgery you've got, whether it's lumpectomy all the way to double mastectomy or whatever it might be. There's things that you can be doing that might not be mentioned to you on a general kind of basis, but listening today, I hope that people are able to pick up some of those things.
Yes, I agree.
Yeah. So I kind of like to ask, if someone could kind of do one thing right now, just one thing to improve their experience with surgery, what would you say that would be?
That's a good question.
You can actually say two things if you want, but
I think that the best thing that someone can do before surgery is just take a deep breath and plan. I think that that's kind of a big answer because planning is a lot of things. But I think that even if I was a patient and I was hearing this podcast, I would think, God, I don't even know where to start. Like, what do I need to work on? But if you just take 5 minutes and kind of assess your nutrition, stress, anxiety, sleep, social support, just those whatever 4 or 5 things, just assess them and figure out, what do I need to work on before surgery? What's most important for me to work on? And I think just by getting that on a piece of paper, it's going to make it seem more attainable and it's going to help you prioritize. Because what I see time and time again, especially in my patients, is just overwhelmed and paralysis from being overwhelmed. So I think that if you take a moment and just plan, it allows you to make the next step strategically and thoughtfully.
hmm and prioritize is the big key here because you don't need to do everything. You
Yes.
don't need to do it all at once. So yeah, like you said, write it all out and prioritize. What do you feel like is going to be the easiest thing for you? And that could be your highest priority or maybe the most effective thing if that's something you can make happen. Priority is
Yes.
super important.
And
And
I think the other thing, oh, sorry, Megan. I was just saying the other thing is that, especially with breast cancer, we talk about financial toxicity. There's so much cost associated with the surgery, loss of time off work, all of the costs associated with medical care. And so if you're hearing this and thinking, this all sounds really expensive, I can't do any of this, there's also free things you can do. Like just doing some meditation and listening to a YouTube is free. Like going to your park and just walking up and down the stairs is free. So there's a lot of free things you can do, and you should not get bogged down by the fact that if you can't afford the supplements, that's okay. You can do other strategic things that are still going to make a big difference without adding to the overwhelming financial burden that is cancer care.
I would even say the free things are most effective.
Yeah, agreed.
Like
Yes.
supplements are great for the little bonus, but the free things are probably the most effective things you can do. So yeah.
Agreed.
Yeah. And a little quick mindset thing too is like, there's a fine line between getting information and feeling overwhelmed by it and feeling excited by it. And those feelings can sometimes feel the same way to be overwhelmed or excited. So take
Yes.
information, be kind of happy to have the information. Don't let it go too far and be excited to be able to have this knowledge and to be able to start making steps and taking control of things. So that's kind of how we like to approach overwhelm is like, it's more excitement, I think, than overwhelm in some situations. Yeah.
Yes. I love that.
Awesome. Where can people find you? I'll make sure that I put all the information into the show notes, but tell us.
Yeah. So my Instagram is at surgical_recovery. And we talk about breast reconstruction and breast surgery, talking about how to prepare for surgery, things to ask your doctors. I love engaging with people. I love hearing stories. People are always messaging me their diagnosis. And I love to engage with people. So I'd love to hear from you. If there's topics that you want to see addressed, I'd be happy to hear, but that's where you can find me.
Awesome. All right. I'll make sure we get that information into the notes for anyone to find you. So thank you so much for joining me today. I think this was absolutely marvelous, and I hope to have you maybe back sometime.
Thanks so much for having me, Megan. It was great.
All right. Take care. Thank you so much for joining me today on the Flourish After Cancer podcast. If you love this episode, please be sure to leave a review and subscribe so you never miss an episode. Sending all my best your way, Dr. Megan.